Hi, I'm Dr. Amy McMichael, and I'm a professor of dermatology at Wake Forest University School of Medicine in North Carolina. And I'm also a hair loss expert, and I'm excited to talk to you today about JAK inhibitors and their use in alopecia areata. Specifically, I wanted to talk to you about the most recently approved medication called Deuruxolitinib. So if you haven't heard about this one, it's the last of the three to be approved. It was approved in July of this year. And what's exciting about this medication is that it starts to work at 8 weeks in our patients. Now, of course, that's not going to be every single person, but when we look at the clinical trials, what we see is that there's already 8-week improvement compared to placebo in both the 8 milligram dosing, which was the approved dosing, and the 12 milligram twice a day dosing, which was unfortunately not moved forward with the company. So what we're getting and seeing is that our patients will be starting to grow hair a lot earlier. And this is earlier than the other two approved JAK inhibitors for alopecia areata. Now, of course, these are not head-to-head trials, so we can't say, exactly, how the differences are with the other two drugs. But what we can say is that it always helps to have our patients get some hope. If their severe alopecia areata is causing differences in quality of life and they're, just really excited about going on this new medication, it always helps to have an early start to regrowth. So that's really pretty cool. The other thing that we know about the two trials, there were Thrive AA1 and AA2 trials, is that we did get a nice separation between the 8 milligram twice a day dosing and the placebo, which was the actual dose that was approved. Very few side effects and complications, very similar to what we've already known about for other JAK inhibitors that we use for alopecia areata. So typical things, upper respiratory tract infections. There was in all of these trials a little bit of COVID because that was happening at the time. And then also no major serious events. There were issues with herpes zoster, herpes simplex, but we know that about JAK inhibitors. So if you can, always think about getting your patients vaccinated with the herpes zoster vaccination before they start a JAK inhibitor, because that will be helpful for them in the long run. But overall, I've had experience with this medication in the Deuruxolitinib trials, so I can speak to that. We are now ending that trial, so that trial has ended as of the 31st. Will have ended as of the 31st of this month. Everyone that was in that trial was on the open label component. And I can tell you for a fact, though I'm not allowed to really speak about the trials, that everybody was happy in that open label trial. We're switching our patients over to our clinic, and so I can certainly talk about those patients that have switched over and already seen them in my clinic, and they are excited to continue the medication. For the majority of them, obviously, that stay in the trial, they've had good results because, if you don't have great results, a lot of times you don't make it to the end of the open label trial. But these folks have really had great results, very little in the way of side effects, and they want to continue the medication. So they're out in my clinic now, enjoying taking medication. And so I think we have another really good alternative. Now, one thing we need to talk about with Deuruxolitinib is that this medication does require a genetic test before you start it. Now, interestingly, that wasn't the case before. When the trial was going on, we didn't know that this was going to be a requirement by the FDA. But when it got approved, they required to have a cytochrome P450 test, the CYP2C9. The LabCorp and Quest labs will do it. I think Quest will be coming on soon, and that'll be mostly on the West Coast. But LabCorp is also approved to do the testing. It has a specific code, and your medical science liaison or your rep can help you figure all that out in terms of how to order it for the patient. Patient goes and gets the lab. They don't get charged. They must really do it with those labs with that code. And then as long as they're not a slow metabolizer of cytochrome P450, this particular one, then they're fine to go on the medication. Now, what's interesting is that, we had to go backwards and draw those labs on the patients that are coming out of the trial. And so some people who were on the drug theoretically could have, been low metabolizers, and that didn't really affect the trial in any way. But, we're going to do it the right way and get those labs. And so we did that on our patients in the trial. All were fine. And anyone moving forward. So we have a couple patients in our clinic who got the labs, were fine. They're moving forward with the medications, and we're hoping to see them back pretty soon because, of course, the drug just come out recently. So we're excited about this new addition to our armamentarium in alopecia areata. Patients are thrilled with its use. There's a little bit of extra lab work that you have to do, but, same lab work that you do with all the other alopecia drugs that are JAK inhibitors, which is your baseline TB testing, your baseline CBC with differential testing, your baseline hepatic panel testing, and your baseline lipid testing, which then you'll do intermittently, which, tends to be every 4 to 6 months for most patients. So just remember, Deuruxolitinib is out now, ready for use. Your patients are waiting, and your alopecia areata patients will really do great with these new JAK inhibitors. So get started if you haven't started using them.